Okay, students. So today the lecture is about pharmacology, and the course code is CAM 4451. This is the first part of the lecture, which is Introduction to Pharmacology, and also you can subscribe to the YouTube Cust channel so as to get updates about how to access the online content which has been uploaded on YouTube for students of the Cohort University. So, pharmacology, moving towards the topic. So, pharma means drugs, and as you know, logos or logi means study. So, the study of the drugs is known as pharmacology. So, the study of the drugs in terms of their preparation, the properties of the drugs, the uses of the drugs, and the effects of the drugs. So, these are all are studied in pharmacology, and in your course contents you can find out that there are different books which are relevant to this topic and other upcoming topics related to pharmacology and mode of action of antibiotics. So one of the books which I will recommend, which is also included in your syllabus, is Lippincott Pharmacology. So either you can access through the Cust digital library, and you can find that book and download it, or you can search online and find that book. And that is very interesting book. It has a lot of information and easy to understand, and it is written in a very plain English, so you can understand, you can learn different terminologies and different topics related to pharmacology. So moving towards pharmacology, basically we are studying a drug in case of pharmacology. So what is a drug? Any animal, vegetable or mineral substance used in the composition of medicines. So that is known as a drug. So either a part of animal or an extract of animal or vegetable or a mineral which is used in the composition, in the synthesis or preparation of the drugs or medicines, so that is also known as a drug. And strictly speaking, according to the Food, Drug and Cosmetic Act, so a drug is defined as a substance recognized in an official pharmacopoeia or formulary. So official pharmacopoeia is actually um, a, a pharmacy book in which all the medicines, their formulas, their um, mode of action, their um, mode of treatment, and their effect, their need in conditions has been included. So that book is known as official pharmacopoeia. So normally you have British pharmacopoeia or US pharmacopoeia or Pakistan pharmacopoeia or Indian pharmacopoeia. So different countries have their own formulary like of the drugs, which are all of them are included in one book so that one can find the relevant drug for use in a relevant condition. So a substance intended for use in the diagnosis, cure, mitigation, treatment, or prevention of disease. So, any substance which is used in the diagnosis or detection of a disease, in a cure of a disease, in decreasing the effect of a disease, in treatment of a disease, or preventing the disease, so that substance is also known as a drug. Another definition is a substance other than food intended to affect the structure or function of the body. So, if you are taking a substance so that if you have, let's say, you have acidity and you are taking normally, people are taking famotidine, so which is anti-acid. So, it is decreasing the amount of acid inside the body. So, basically, it is altering the function of the body, And sometimes the structure, for example, if you have a bone fracture, and certain painkillers and other antibiotics are given to the body so that the bone can heal properly with the passage of time. So that is also referred to as a drug, or a substance intended for use as a component of a medicine, but not a device or a component, part or accessory of a device. So as a component of medicine means that when you are taking a medicine, for example antibiotics, so in antibiotics you have an active ingredient. So along with an active ingredient you have other accessory uh, compounds or chemicals which are added to the antibiotic formula so that the drug is in the palatable form and it can reach to the site of action. So those accessory substances or compounds are also referred to as drugs or medicines, but not a device. So if you think about a device, for example, if somebody has a problem in breathing and he's on a ventilator, so ventilator is a device. Similarly, other devices like pacemaker, which is like installed or established into the heart, inside the heart, so these are actually devices, so they are not referred to as drugs. But those uh, substances or compounds or chemicals which are added along with the active ingredient and then taken either by mouth or through injection or in the form of a cream or ointment, so then they are referred to as drugs. So moving towards differences between drug and poison. So normally all the substances are poisons. There are no distinct borderline between them. Any drug will be toxic once they are overdosed, and the toxic dose is the lethal dose. So here you can understand that when a drug is given in a normal dose, the required dose according to the severity of the infection, so then that dose is known as um, applied dose or given dose. But if the medicine is given beyond that concentration, so then it becomes lethal. For example, like most of the antibiotics which are given by mouth, for example ciprofloxacin or ofloxacin, so they are given in the concentration of 250 milligram or 500 milligram or maximum 1 gram per day. But if the dose is increased and a patient is given like 2 gram or 3 gram or 4 gram of the antibiotic, so then that dose becomes lethal dose, and it has toxic effects on the body and it can cause even death. So that is the difference between drug and poison. So a drug, when given in appropriate amount, so then it is a drug. But if the drug is not given in an appropriate amount but exceeding the appropriate amount, then it becomes poison. So in that term, all the drugs they are poison, and all the poisons are drug. So you have to be careful when you are giving a patient a drug, an antibiotic or a painkiller or any medicine. Right. So what is pharmacology? So the study of how drug affects a biological system. So as we discussed earlier, that it is the study of the drugs and the interaction of the drugs, the properties of the drugs, the uses of the drugs, and the effects of the drugs. So the pharmacology is divided in two types. One is pharmacokinetics and one is pharmacodynamics. So in case of pharmacokinetics, it is the study of the body taking action onto the drug. So in terms of ADME, that is absorption, distribution, metabolism, and excretion. So whenever you are taking a drug by mouth or by intravenously or intramuscularly, so actually the body is taking that drug to the site of infection. through the circulatory system, and during that course of reaching to the site of action, the drug is being absorbed, it is being distributed inside the body, lately it is being metabolized, and ultimately it is being excreted after it has done its mode of action. So that study in which you are looking at what the body is doing to the drug is known as pharmacokinetics. And the other branch of pharmacology is pharmacodynamics, and which is what is the drug doing to the body. So basically, in case of pharmacodynamics, you are studying the mode of action of the drug. For example, if you are taking antibiotic, so what is the mechanism of action of the antibiotic? What the antibiotic is doing inside the body? How it is killing the bacteria? What is the mode of action? So that is studied in the branch of pharmacodynamics within the pharmacology. So this is all about the first part of the lecture about pharmacology, and if you have any questions or if you have any queries, so you can um, ask me through WhatsApp group which you have created, or you can leave a comment on the YouTube where I will upload this lecture, and also I will upload the slides on the KCMS platform from where you can download it, and yeah, give me feedback, and let's see how it's going, and I will upload the next lecture uh, after this. Thank you.